Welcome to Meaningful Work Matters. I'm Andrew Soren. Today, I'm joined by Anu Gorukanti and Laura Holford, two healthcare professionals who are reimagining what it means to heal, to lead, and to work in alignment with their deepest values. Anu is a pediatric hospitalist and a public health advocate in Los Angeles who works at the intersection of medicine, health equity, and racial justice. Laura is an oncology and community health nurse in Sacramento who helps others navigate burnout, moral distress, and the spiritual dimensions of caregiving. Together, they run an organization called Introspective Spaces, where they bring a shared belief that reflection and contemplation are not luxuries. They're essential for social change. Drawing from liberation theology and years of experience on the front lines of healthcare, they invite us to see how inner transformation and outer action are totally intertwined and how meaning arises when we can hold both in balance. In our conversation, we talk about what it looks like to build reflective practices into our daily work, how systems can honor the humanity of both healthcare providers, caregivers, and patients, and why slowing down might just be one of the most radical acts of all. Welcome to the Meaningful Work Matters podcast. I'm your host, Andrew Soren, founder of Eudaimonic by Design. On this podcast, we'll dive into the world of meaningful work, explore its complexities, and examine its impact on people and the organizations they're a part of. Each episode features insightful conversations with cutting-edge experts who are successfully navigating the challenges of meaningful work. We hope to offer you ideas, frameworks, and tools to unlock potential and design work that's fulfilling, impactful, and supports everyone's well-being. Subscribe or follow us now, and let's make meaningful work matter. Anu Gorukanti, Laura Holford, welcome to Meaningful Work Matters. It is very exciting to have you both on this podcast talking about an incredible organization called Introspective Spaces. You run an organization that I've known about for a couple of years now, ever since one of the very first podcast episodes of this podcast. I actually think that it was like the second podcast. The first guest that I had was Donna.
Oh,
Yeah, I know. She was like, so Donnie Gaffney, for those listening, an incredible nurse practitioner, nurse educator who came onto this podcast, and the very first guest that we ever had to give us the story of what meaningful work looks like in a healthcare context. Um, yeah, in that episode and in other places, Donna talked about the incredible work that the two of you do in introspective spaces. So it has taken us like 55 episodes to be able to get to you, but you're here. Welcome. Thank you so much for joining me today.
thank you. It is an honor, and I feel like we've all come a long way from, like, when we had dinner together in Westwood to actually getting to be on your podcast together, so really, really excited to be here.
First thing that I always ask my guests to do is to introduce yourselves. Tell us a little bit about who you are and what makes your work meaningful. And I don't know, Anu, why don't you start?
Sure, so honored to be here. So my name's Anu, pronouns she, hers. I'm a pediatrician, mom, partner, dancer, like, artist, person who just loves to build community, and one of the co-founders of Introspective Spaces. And I think for me, what makes work meaningful is a place where you feel a sense of belonging and you feel like what you're doing ideally contributes to making the world a place that is more just, more kind, more collaborative. And I wish I could say my healthcare job felt like that. It I do I think many of us do the best we can to try to embody those values when we go in, knowing that it's not structured that way. But I think one of the blessings of my life has been able to start introspective spaces and to try to build an organization that's rooted in those values, that really tries to cultivate space for people to be their authentic selves, which for me has been meaningful and has kept me in healthcare.
Beautiful. Issues that I'm sure we're going to be talking a lot about over the course of this episode. Laura, why don't you go next?
Thank you. Yeah, I'm Laura. I'm a nurse. I am in Sacramento, California. I'm also a mom and co-founder of Introspective Spaces. I agree with Anu. There's a lot of systemic constraints that make finding meaning in healthcare the way it is extremely difficult. But we have found it together what I think of as a training ground to practice um, vulnerability, coming home to ourselves, rooting in our creativity and spirituality so that we can pursue those moments of meaning in our work, so that we can have eyes to see them. I think Anu and I perhaps lean too much into meaning making. We're meaning making machines, and sometimes I wonder, is this a curse? But ultimately, I think we're in good company here. So,
Hmm. For those who have listened to this podcast, and certainly both of you know, there are dark sides of meaning. It's not
Mhm.
always a good thing. Although certainly meaning itself isn't necessarily always the problem. It's all the things that surround meaning, which are, I think, probably some of the things that we're going to get into as we talk about healthcare as an industry that is
Mhm.
incredibly complex, getting maybe more complex every day. So maybe we could just start there. Maybe, like this, where the headline of this episode is probably going to wind up being something around humanizing healthcare, which is probably where we're going to
Mhm.
get. But maybe before then, just tell us a little bit about what is the current state of healthcare according to the two of you?
Oh, man, I feel like that's a big question.
Huge. Let's say the current state of healthcare when it comes to some of the challenges to meaning, some of that, like maybe the dark sides maybe of for people who feel deeply passionate about their work.
Yeah, I think that's one of the things that makes healthcare really complicated is I won't say everyone, but the vast majority of people who go into healthcare come in with this intention to do this job to help other people. And as we progress through our training paths, which vary by every specialty, but are usually long and arduous, that oftentimes by the time we come out through the training itself, we lose a lot of who we are. And then when we enter this workforce, we realize we're entering a very profit oriented capitalist system. And we recognize, like, wait, these values of justice and compassion and relationality that maybe brought me into healthcare are not reflected in the way that I'm allowed or encouraged to practice taking care of patients. And I'm sure Laura and I have many, many examples of stories from our time of feeling really disillusioned that we spent however many years training and then are actually sitting in front of patients who are in the most vulnerable parts of their life. And people don't have access to the resources, but we're in institutions that absolutely have funding and are choosing not to spend money in that way. We have organizations that stay silent and are complicit with in like structural inequities happening in US and abroad in places like Palestine. All of those things integrate in our ability to do our jobs. And so I think it makes it really challenging when you go to work and you realize that you're kind of living with this grief all the time, that you believe that people deserve better than what they're getting in the healthcare system. And a lot of healthcare workers will break themselves before they will let a patient be injured. And so that's where many healthcare workers are. Like, how do we keep showing up and how do we keep finding ways to do our best for patients with the resources that we have, many of which are continuing to be cut right now, and also holding this truth that we have a lot of power. We have the ability to take care of each other, and so even though we're working in this system and this structure that is deeply harmful, we don't have to replicate that amongst each other. We can do the best we can for our patients, and we also have the ability to reclaim our agency outside of our workplaces.
One of the things that I've heard both of you speak about, and certainly we'll get into what introspective spaces actually does, because I think that to a certain extent, some of that is at least what you see as some of the solutions. Like what can we do about this? How do we reclaim that agency? But I've heard you talk about this idea of moral injury, and so um, I think that very much builds on everything that you were just describing. Can you unpack what that term means and help just understand the way that kind of the relationship between moral injury, moral distress, and the systems that we happen to work within.
Yeah, moral distress is a term that originally came from the military. So you have like a highly ordered society in the military. There's a strong hierarchy. And so you often have to carry out orders that go against your beliefs or your values or your ethics. And so you can see how that directly applies to healthcare as well. We're in a hierarchy situation and are very constrained by norms, culture, and orders to act in a certain way that doesn't always align with how we want to. And to be more specific, in a humanizing way, we're working in a system that prioritizes profit over the human being in front of us or the human being clinician. And when you center profit, you aren't able to act in a humanizing way that, as much as you would like, that aligns with your values. And that feeling, the feeling of disgust, of shame, of voicelessness, of just feeling terrible, that is moral distress. It's that feeling of not being able to take care of somebody the way you believe is right. Um, and moral injury is when that persists um, and doesn't go away. And then if you take it even farther, I think 2025 in March, they just came out with moral injury disorder. So that's when it's like just rooted in and not going anywhere. And recently they have tied these three titles together on the moral injury spectrum, or sorry, moral trauma spectrum. And I thought that was a helpful concept for me to understand. This isn't PTSD, this isn't depression, but there are these overlaps, these compounding factors, and there is a layer of trauma involved. But yeah, the core is not being able to take care of a human the way that you want to.
Can you share a little bit about what would it look like to experience moral injury? Like, what are the kinds of things that people experience in that context?
Well, moral injury, the definition I was just reading recently, it's when your sense of goodness has been shifted, whether that's your own sense of goodness, whether that's your belief in the goodness of institutions, your belief in the goodness of your higher power or your religion, and kind of you lose that sense of what is good and bad, and you're left with the feeling of shame. So, like that lack of goodness or that shift in that lack of goodness is that shame. And it also, like I was saying earlier, feels like powerlessness. You lose sight of the fact that you do have agency and the ability to change a system because it becomes so encompassing. And every single day, you see how your actions fail others. So we talk about the three key features being powerlessness, isolation, and shame. Um, the isolation piece is feeling like you're the only one that's experiencing this, and that just deepens and worsens this because you don't realize that other people are in the exact same situation, and so then folks spiral out, and that's when we see depression, anxiety, and those other more clinical symptoms. I don't know if you'd add anything to that, Anu.
No, I mean, I think that that is totally how we would describe it, and I think the way that it actually plays out in, like, healthcare settings is, like, not having enough staffing. And that's a very, very common, prevalent challenge where you realize there's just not enough people to do the tasks that need to be done. And what that means is that patients have to wait a long time for necessary medications, or they may be in pain, and we may not be able to address. Cut to them as quickly as we want to. In my context in pediatrics, it may mean that patients have to be transferred to another institution because we don't have access to the resources they need. It means losing access to essential programs like medical legal partnerships, where you ordinarily would have been able to help families if they shared with you a challenge. Moral injury happens in the hospital and it also happens outside of the hospital. It's also like bearing witness to the lived reality of many people's lives. And so in my context in a county system, a lot of that is hearing people's stories and realizing like, oh, this family doesn't have enough money for food. Like this family does not have a place to go, and feeling helpless to know that there are these structural barriers to this child, this family living a life where they're able to thrive. And as a clinician, not having the time, the resources, the support to be able to offer them everything that they should have.
Laura, you talked about this sense that it's an attack on goodness,
Mhm.
which is really interesting way of being able to frame this topic. It's something that I've been spending a lot of time thinking about, especially in the context of everything that I do on this idea of eudaimonia and eudaimonia at work. And eudaimonia, I mean, the actual etymology of that word is a good spirit. This idea that within all of us is the desire to do good, this spirit that is trying to attain, and the incongruence of being able to work or live in a situation where that goodness that you are aspiring to do feels like it's being ripped apart
Mhm.
is oof, like it's heavy,
Mhm.
and it feels like, I mean, obviously, we're talking about the context of healthcare. We're especially talking about the context of healthcare in the U.S. I'm in Canada. Healthcare is probably different here than it is in the U.S. And at the same time, I feel like these issues transcend so much farther beyond healthcare. I mean,
Mhm.
it truly is any job where there might be a moral stake, where the idea of trying to do goodness, of trying to do good, of trying to
Mhm.
unleash that moral spirit that you have within, can be attacked by forces outside, not only in the institution that you're working in, but also in the community environment that you're in, potentially in a religious context, potentially in a political context, potentially, you know, the other side of the world. You talked about
Mhm.
Palestine and like the experience of, today happens to be when we're recording this episode, Erev Rosh Hashanah. So tomorrow will be the first day of Rosh Hashanah in the Jewish calendar.
Mhm.
And as a Jew, I can't help but thinking about the moral injury of like what is happening in a land that is supposedly a land of, you know, in my name, and like what the moral injury of that might be. Uh,
Mhm.
so I'm kind of curious the kind of compounding layers as you
Mhm.
see it, and what the impact is of those, Russian dolls of moral injury.
Mhm. I absolutely agree, and thank you, Anya and Andrew, for bringing up the higher layers. I personally feel like my moral distress as a healthcare worker has gotten a lot better since I've changed to a different environment that has more resources and better staffing. So, like, day to day, it's better. But then what's happening with the genocide in Gaza, I'm like, why should I, try to advocate for this child who has asthma and like wait on hold for an hour, like when children are being targeted by snipers? It makes that work feel very pointless. And so that's kind of the layer my moral distress has been coming on recently in my clinical role. Um, but yeah, I think all those layers impact that how we show up at work and how we take care of our patient.
Yeah, I just wanna, like I wanted to name my appreciation for being able to, like, bring in all those layers because I think the first step or the first challenge that we have within our culture of healthcare is that we don't have any space really to acknowledge our own humanness,
Mhm.
and I think there in the clinical environment, we focus a lot on being objective, and which makes a lot of sense in, like, the context of you have to follow up on labs and you have specific values, you have specific diagnoses. And so there's a lot of merit to being objective. But I think when we do that, it's like many things, when you decontextualize things out of the context in which it's in, you're like, these objective values are in living people. And each person has layers of grief, of moral distress, but also of joy and delight. And like everyone, it has these complex things that they're carrying, both patient and clinician. And so I think first, even having space to acknowledge that people may be emotionally impacted by their work and to
Mm,
not be actually maybe more concerning based on the kinds of things that we see that most people around the world don't have privy to, like the amount of suffering that we witness each day inherent to our job. So I think to me, that's like a big, very easy area of healthcare to start naming. It's like, why do we have this culture where we don't allow ourselves to talk about the emotional and psychological and spiritual impact of our work, which is maybe even what drew us into the field in the first
In the
place?
first place. The thing that was meaningful, that
mhm,
notion of beyond self.
mhm.
Mhm.
Absolutely. You mentioned just before we started this call, I mean, the topic of humanizing healthcare really starts with seeing the human in one another. And so I'm wondering if you can, as we take this idea of moral distress, moral injury, and try to figure out, well, what do we do with this? Like, how do you hold this extraordinarily heavy incongruence and try to figure out what do we do? Where do you start that story?
Well, I think um, when Anu was talking about the current state of healthcare, there's, in addition to kind of the patient experience being lacking, there's also kind of this division between healthcare workers and even within professions as well. Like perhaps you've heard in nursing, there's a lot of like lateral violence between, staff and workplace violence and um, between different professions. We're trained separately. We are taught to stay in our own lane. And something that surprised us, we did not set out for this question. Um, we started doing the Artist Way for healthcare workers about a year ago, which was gathering individuals across the medical hierarchy: nurses, physicians, CNAs, chaplains, SLPs, PTs, anybody who interacts with the medical industrial complex who experiences moral distress. Because you can be a therapist and not be able to get insurance for your client. That's moral, that could lead to moral distress. We're all impacted by the system. And as we did these groups together, the Artist's Way, centering and creating creative practice for healthcare workers together, we started to fall in love with each other, and we started to see each other as human. For some of us, for the first time, it's hard to explain to folks outside of healthcare how radical that is and how radical that feels to sit down next to a physician and hear, as a nurse, to hear what's in their heart and to hear that they're distressed as well and to hear that this affects them too. And it's not just me. And just to see those moments happen, like it gives me goosebumps. And so that kind of, yeah, by surprise, we're like, wait a second, like we started this journey, in pursuit of humanizing healthcare. And we're like, maybe the first step is humanizing each other and building power collectively, knowing each other, seeing each other as human, um, being vulnerable with one another. It reminds me of one of my favorite posters from the civil rights movement, from the Poor People's Campaign. I think it was 1968 or 69, but it shows a bunch of different feet of different races. So, like black and white and Native American and Asian. And it has a quote on it. It's like, "I'm concerned, Governor, they're getting into step." And
Mm,
I
mhm.
feel like we're getting into step and watch out. And, when we build this collective power, I think we can start to change, I mean, those systems that are creating this moral distress to begin with.
Hmm.
Um,
Uh, an assumption that I make about healthcare, which I'm assuming is also maybe an assumption that I make about many people who do deeply meaningful work, is that boundaries are really important. Putting up the walls
Mhm.
that protect you from from the things that potentially would allow you to be vulnerable are actually a
Mhm.
really important way of getting through the day and are maybe even an important way of thinking about what training is. Is that a fair assumption to make about the field?
Yeah, I think it's something, actually early on in our work, we did a lot of workshops around boundaries, mostly because it's kind of a paradox in healthcare.
Mhm,
It's like there are a certain amount of boundaries or separation you have to survive, to be able to get through, in my case, like 80-hour work weeks and working 6 months of nights and, like, whatever it is that it takes to get to the other side. And then when you start, you're kind of grappling with, like, how much boundary do I have between myself and patients? How much boundary do I have between myself and my colleagues? What am I allowed to show of myself in this space? What if I show too much? And how are people going to respond to those things? What amount can I share and still come back to work and find sustainability? And how do I navigate boundaries when people are asking for my help, but it's more than I can give?
mm,
Or when my work is taking advantage of my altruism and asking me to do more than my job is meant to do. And so I think it's like this impossibility that people are in where some amount of it is for your own survival and sustainability, and also it begs the question, like, why do we have a system set up in this way that in some ways it penalizes people who bring their authentic heart to work? Because you're like, that's the person that's going to get asked the most to cover when the unit is short staffed instead of adequately hiring enough staff, or the person who is going to get put in all the shifts when someone is on parental leave, even though they knew about that many months in advance. And so I think it's that tension of like that's the one of the things that we talk a lot about too is like, what does it mean to find sustainability in this work? And part of that is grieving, like, there's just no good healthcare job and there's no perfect way you're going to be able to do this. And so each person has to come to that decision of what sustainability looks like. And part of what we hope to offer is a community space with other people who are wrestling with those same questions.
Hmm. It reminds me of another episode of this podcast fairly early on with Jeff Thompson, who did the study on zookeepers, and the dark sides of calling when it comes to
Mhm.
zookeepers. I would imagine there's a lot of parallels between everything that you're describing in healthcare and those who look after animals. And what he talked about was, as somebody who studies the idea of a calling, that a calling is actually a very religious concept. The idea of a calling comes from a kind of quite Christian mentality of being called to God, and the idea of a calling inherently was always something that involved pain, suffering. That
Mhm.
you aren't called for because it's easy. You're called because it's hard, and you're committing to something incredibly hard and challenging, which is interesting. I mean, I know that spirituality is a big part of the work
Mhm.
that both of you do in introspective spaces, and kind of coupling creativity and spirituality to give
Mhm.
people a sense of entry into a path forward. I don't know, maybe is there something that you can share a little bit more about those intersection points?
Mhm. That was put so beautifully. Thanks for wrapping that up so nicely. I think the word suffering hits a lot for us.
Mhm.
I think as healthcare workers, you're right. We went into this choosing to face suffering, and we're not afraid of suffering in that way. We chose it in desire to serve. And I think that's where moral distress comes in. It's like the unnecessary suffering. It's like
Mhm.
we understood the suffering of death and of difficult diagnosis and life cut short and pain and all that, but what we didn't expect was the suffering that's totally preventable, that an
Mhm.
individual who owns a hospital system is profiting off of the premature death of patients. Like, I did not expect that personally. Um, and yeah, so I think it's very fascinating because it's like, yes, we're here for the suffering, but we're also just sideswept by this unnecessary suffering and the powerlessness that we have to prevent that. And so, yeah, I think for me, I'm Christian. I definitely came in with that sense of this is an expression of my faith. This is a way that I can express my spirituality as action in the world. And to be devastated by how that is not in line with our healthcare institutions in any way, I think I was quite naive. But that's what Anu and I have been doing is how do we root back into our spirituality, our
Mhm.
values, what brought us here to begin with. Healthcare is extremely um, like secular, and as Anu was alluding to earlier, there's an armor that is expected to be worn at all times, and to show that you need something besides yourself could be seen as weakness. And so that's what we're trying to do together is to create those spaces where we can acknowledge that we need something else besides yourself, whether it's one another, whether it's rooting into these invisible threads of spirituality, or your higher power. And there's a concept in the book The Artist's Way that we have been using to guide these weekly groups. She actually equates creativity and spirituality as the same thing, which
This is Ellen Langer. Is that who
Um,
we're
Julia Cameron.
Julie Cameron.
Julie Cameron? Great. Another artist way. There's like
Yeah,
Mhm.
yeah. And so I think that language has really helped open up
Mhm.
healthcare workers to access their own spirituality in a way that
Mhm.
is safe, because of course, we acknowledge that spirituality and religion has caused a lot of harm in healthcare settings, and so finding a way that we can access that rich resource, of what, this calling is to us. We also look to a lot of, original hospitals were opened by orders of spiritual people living together in community, with sacred texts, with
Mhm.
rhythms of contemplative practice, with a rich tradition of creativity, of whether that was song or illustrating texts or tending plants. So we're just trying to recontextualize, this act of caring for another human, and um, say a lot. Nothing that we're doing is new. We're only returning to what is ancient, um, and doing it across, lines of um, profession, medical hierarchy, spirituality, religion, etc.
hmm,
So trying to equip ourselves to face that suffering together, that we don't have to face it alone. And um, we take great inspiration from Henry Nouwen and the wounded healer, that actually, our most powerful thing we can bring to the patient encounter is our presence. And
Mhm.
how can we not hide that like we've been trained to? Like Anu said, for very good reasons, of course, but how can we show up with that human presence? How can we um, tap into our own woundedness as our most powerful place to connect with our patients? And I found that to be extremely true. And when, time is our biggest constraint, we're always trying to reduce the amount of nurse time, the amount of physician time, increase patient
Mhm.
ratios constantly. Those moments are the first things that are erased, because spirituality is an unimbursed, it's, you can't reimburse spirituality.
Mhm.
It's not something that you can code and, build a Medi-Cal or what have you. Um, so we're trying to create a world together where in healthcare, where those things, do have value again, whether they're, paid for or not, but we decide that they have value. And um, yeah, we're working together to bring that back.
hmm. Beautiful. It's beautiful. There's so many. As I listen to you, there's a smile on my face, but it's a smile of just like deep gratitude that there are people doing this work and finding the ways of pushing the boundaries. I'm really interested in the idea that you bring so many different people within the system together to
Mhm.
a common ground. I mean, just the fact that a nurse and like a pediatrician are like both in this leading this, like the hierarchy you named and talked about is something in and of itself that you're trying to tackle. I find that
Mhm.
interesting. Do you have more that you wanna say about that interdisciplinarity or pulling different kind of levels of the system together?
Yeah, happy to share a little bit about it. I think one of the blessings of our work is that Laura and I were friends for a long time before we started Introspective Spaces. So we knew each other when we were in our 20s, like on this healthcare journey, and have kind of seen each other through our evolution of like gaining this healthcare identity. And so what bonded us as friends was our shared love of contemplative practice. And for myself, as someone who's Buddhist, my relationship to spirituality is very different because I don't come from an Abrahamic faith tradition. And so in Buddhism, there is a lot of emphasis on like right action and right value. So the side note of like when people bring in like meditation, but decontextualized, it's very painful because you're like, no wonder this feels a little dissonant. It's outside of
Or
Buddhist ethics. And Buddhism is always meant to be practiced in Sangha, which is community. And so for both of us, our spirituality was a driving force that brought us into healthcare, and it was also the thing that kind of helped us recognize, like, what we're experiencing is not the only way. Like, this cannot be the way. And for myself, going through my training, my primary reaction was just anger. I was just angry for years, the entire all of my training, and it was a very unusual feeling as someone who doesn't really identify as a super angry person, but it was like our friendship of being like, "Oh, yeah, my friend Laura, who also has this deep commitment to justice, is feeling the same things in her role as a nurse." And so when I would go to work, I would be like, "I'm not at least I know I'm not the only person," even though it feels like these crazy things are happening where maybe trigger warning, but we would be like a child would die on rounds in the morning and we would just keep going. And then there would never be time to grieve. And at least I knew I had this person I could call to be like, this is crazy. Like, how did we not talk about this? And so I think our own friendship over many years is the foundation of this work because I feel like it has changed how I practice like, clinical medicine. Like, when I go to work, I know everybody's name, and I
Mhm.
that's a very important part of, like, knowing every member of the team, and part of that was like, "Oh, it's because, like, I'm friends with people across the hierarchy," and I think a lot about how the hierarchy is harmful to not just the people who are kind of, quote, unquote, "lower on the hierarchy," but also to physicians and how much it harms us. And so I think that's why our work, like Artist Way and all the work that we do is interdisciplinary. And I think it's really beautiful because people are so rarely ever in a room with other healthcare workers. Rarely we have these
Mhm.
conferences and things, but everything is kept at such a surface level that you never have a space where like you're actually grieving together and and you recognize that the things that you're grieving are actually all the same. That what you want is this liberated healthcare system that we're all trying to work towards. And I think that is one of like Laura shared is like one of our dreams is for people to build those authentic communities of care outside of the healthcare system to know that like you have this group of people that feels the way that you feel and also can help open your perspective. And so when you go back to your job, you understand what a CNA is going through. You understand what an LVN is going through. You understand what a respiratory therapist is going through. You can see the physician on your team in a different way and realize like
Mhm.
they're probably so burnt out and that's maybe why they are. It doesn't excuse harmful behavior, but I think it helps people contextualize people in their humanness. So when they go back, they can hopefully see those other people in a different light and bring that vulnerability into their own healthcare system.
Mm. It's so important, uh, the ways in which you're articulating the "we" orientation here as opposed to the
Mhm.
"me" orientation, that so much of what well-being is, so much of the ways in which we
Mhm,
think about training for resilience feels like it's about training at the individual level, giving someone the skills, the resources to be able to tackle the traumas that they might be encountering in a proactive way. But so little of that is about actually bringing people together and creating spaces and creating collectives and creating
Mhm.
community and recognizing that this is actually the work of muddling through together,
mhm,
being together. That's the thing. This is team sports. This is not solo sports.
Mhm.
Hmm.
Yeah, we really believe in the power of community care. And, we moral distress can be that loss of faith in the institution.
Hmm.
And that can feel like we've talked about, you feel like there's nothing you can do and that powerlessness. Um, and we take inspiration from the Catholic worker movement, the Black Panthers, who are like, okay, this is the way that society is right now. We could just wait and do nothing, or we could just take care of each other, like while we're waiting, because society's not showing up in the Catholic workers case for the houseless folks, and the Black Panthers not showing up for the Black people, and so they started feeding each other, and they started taking care of each other, and so we've kind of adapted that model for healthcare workers. We're like, our institutions clearly don't care about us; they only
mhm,
care about money and the bottom line, and we still have this power to take care of each other, and that's been so healing for our agency to kind of practice that healing vocation again, to be like, "Oh, wait, I actually can heal somebody, and it may not be my patient, but it's my fellow physician or my fellow nurse," and we're starting to feel that power of healing again, of taking care of each other again, and then we can, build up that agency, and take that back into our clinical environments where we're like, I actually remember that I do have the power to heal. Um, and to bring my gift of presence to my patient, which is totally devalued by the system. Um, and yeah, Peter Morin of the Catholic Worker, he said, we can build the new in the shell of the old. And so that's how we see our communities of care. We're building a tiny little new thing in the shell of this crumbling system. And we don't know what the future holds. We will continue to advocate for a just healthcare system, and we will continue to organize for that. Um, but we also need to get from moment to moment, day to
Mhm.
day. We need to show up for our jobs in a way that doesn't, um, burn us out. So we take care of each other while we wait. And it's been really beautiful. And we have communities across the country. I think we have like 10 or 15 groups going right now, and we're
Mhm.
really trying to go more geographically based as much as possible so that um, folks have people where they're at, not necessarily within their institution, because that can be difficult to
Mm.
show up as your authentic self. But like I said, we see these as training grounds where you can start to show yourself in a professional context. You can show your humanity, and um, we hope that that helps folks bring their humanity back to the bedside.
Mm.
Um,
I mean, you just talked about the bedside, you talked about patients a little bit. I'd love to just hear a little bit about the mutuality that goes on between kind of patient care and caring for the person caring for the patient. How do you guys see that interrelationship?
Yeah, I think we've spoken a lot about hierarchies, right? Like there's hierarchies within the healthcare system. And I think one of the other hierarchies to dismantle within ourselves is a hierarchy between ourselves and our patients.
mhm.
And I think that's one of the ways that I imagine really mutuality of recognizing that we all have value and we all have things to learn and share with each other. And I think it's a nuance in healthcare, right? Like we train for a long time to build this knowledge set. And so I think it's not to say that everyone necessarily knows exactly the same, but it's more to think about when we're in relationship with somebody else that we're willing to be present, that we hear each other's stories, and depending on people's comforts, you're allowing yourself to be human too. And so in my context, I take care of patients right after, like newborns, right after they're born and premature infants. And so for me, mutuality means like I'm honest about my own experiences as a parent. And I let them know, like, hey, like, this is what I've been trained to talk about. This is like the evidence behind it, but let me share with you like my human experience of what it was like to struggle with breastfeeding and what it was like to recognize that some of the recommendations that we have are very challenging to live out in a world that is so inequitable. And let's just name those things. And so I think that people can actually practice this mutuality in different ways depending on their own sustainability and comforts. But I think the work that we can all do is really think about where is the hierarchy showing up and that you can hold multiple truths at the same time, that you can hold the expertise of your medical degree and also hold that people are navigating complex and nuanced lives that we're not privy to outside of our clinic walls, and that we can offer a recommendation, but we don't always know what's best for people. And that's a challenging tension that we don't get a lot of time and space to really talk about.
I would just add to that also that when we tend to the well-being of clinicians, patient outcomes get better. We talked about spirituality, and I think that's the ability to see the invisible threads that connect us. And I don't think our institutions see those invisible threads that connect the patient and the clinician. But when we do put our energy and our resources on our clinicians, the patients benefit, and that's kind of showing how our well-being is inextricably connected ultimately. And similarly, when we put our resources on our patients, then our outcomes improve as well. And I think that's been a helpful portal to enter into our work, because a lot of healthcare workers, don't want to take care of ourselves, but we're so altruistic and trained to only care about, other people, and their outcomes. It can be a helpful way back into caring for ourselves of like,
Mhm.
oh, okay, like actually if if my well-being is in a good place, then this person gets less medical errors. They have shorter stays in the hospital. They have a less risk of infection and a less risk of dying. Okay, I will take that morning walk. So it kind of has also been that backdoor entry into understanding our own well-being.
Mm.
And if I may, I have a beautiful quote from somebody in our one of our groups that I think displays this idea of mutuality. Um, she said, "Today I was moved to tears by a patient's story. Instead of apologizing like I normally would, thinking it was unprofessional, I just said, 'I feel your story deeply.' She smiled and said, 'You're human.' It was a special moment."
Well, if people want to know about introspective spaces, I want you to tell them how they can actually be part of the work that you do. But maybe even before you do that, if somebody, maybe not in healthcare, maybe in healthcare, but wanted to try to create an introspective space within their organizational context or maybe their disciplinary context, what advice would you give them? Where would you suggest they start?
I would say it only takes two. Find a kindred spirit, and how Anu and I started was as accountability partners. That was how there was no idea of we're gonna start something. It was just I want to live within my values. I want my work to be meaningful again. I wanna not quit this job. Already
Yes, I
sunk too
want to
much.
not be distressed, every day going to work.
Yeah, so we just I was like, Anu is somebody who, like, I want to be like, and, like, so I reached out to her and I was like, "Hey, would you mind, like, helping me stay accountable to who I want to be, like, and to center my values in my work because everything in my work is kind of eroding those." And so, yeah, that would be my advice is,
Mm,
find one other person who shares your values and start meeting with them and see what happens.
And I think the thing I would add is one of the lessons we learned from The Art of Gathering by Priya Parker. Like, I think our two foundational books that we recommend anyone read, Art of Gathering and Emergent Strategy by Adrienne Marie Brown. So read those first. But I think one of the things that Priya Parker talks about is like you can only take people as far as you're willing to go in terms of your own vulnerability when you gather. And so I think that's one of the things that Laura and I have really tried to embody and learn is like we have to first be rooted in our own values, take our own time to slow down and practice the things that we're trying to embody. And so I think for anyone who's kind of thinking about like how do we build these spaces, it's like allowing yourself to be honest first with like the hard truths. And for myself, it was a few years after I graduated of having to be really honest about who I thought I was going to be and who I was not. And so I think if you're able to live with you're who you are not, then you can live with who you actually are.
mm. Well said. If people want to actually be part of your versions of introspective spaces, where do they go? Where do they learn more?
Head to our
Yeah.
website, yeah, and
Which we will link to. We'll make sure
yeah,
that we link to it
and
in our show notes.
we're on Instagram and Substack as well, and I think the best way probably would join our newsletter, so you could,
Mhm.
we love to, curate, all the events and things not only within our community, but that are happening across the world too, so, um, that's a great way to just keep an ear to what's happening out there.
Yeah, and our work is open to anyone involved in the medical industrial complex. So it includes healthcare workers, mental health professionals, and so folks who are kind of intersecting with all those complex layers, especially in this really challenging political time. Just knowing that you're welcome in this community and that we have space for people to be honest and authentic about the things that they're navigating.
Mm.
Think and we encourage folks if you're interested in joining our Artist Way program, we have the wait list up for spring 2026. The cohort is so beautiful right now. We have about 70 folks doing it around the country, and so we're excited to keep building these spaces. Ideally, every major city has a place that they can turn to.
It's such beautiful work. It is so important. I mean, it's such a complex time, and there is so much moral injury, there is so much moral
Mhm,
distress, there is so much pain and suffering that I think so much of us are bearing witness to in these moments. And it can feel completely immobilizing and
mhm,
completely paralyzing, and like you just can't do anything other than
mhm,
retreat.
mhm.
And it is so inspiring to have both of you share The ways in which you're not only just meeting that suffering, but also giving people a sense of agency and a sense of choice and a sense of connection to each other to just
Mhm.
recognize that the only way through this is
Mhm.
with each other. I'm very grateful. Thank you so much for sharing today.
Someday, we hope healthcare will employ your services and think about how to make healthcare meaningful.
Here's to hoping.
Yeah.
Yeah.
Thank you for joining us for another episode of Meaningful Work Matters. If you haven't already done so, be sure to subscribe to our podcast on your favorite platform. And if this episode resonated with you, please take a moment to leave us a review. Your feedback helps us make this podcast better and reach more listeners. You can connect with me, Andrew Soren, on LinkedIn, or visit www.eubd.ca to learn more about Eudaimonic by Design. Finally, if what you heard today spoke to you, tell your colleagues and people in your community about our podcast. We really appreciate your support in making meaningful work matter. See you next time.